It's been nearly a year since Multnomah County opened this deflection center in southeast Portland, a place officers take people caught solely with possession of hard drugs to connect them with treatment instead of sending them to jail. The center opened amid major pushback from the neighborhood.
Nothing is really changing for the better.
Jens Knudsen is the co-chair of the Buckman Community Association.
We did anticipate a higher volume of people entering the neighborhood and sticking around. Truth is, they haven't been bringing that many people there in the first place.
Recent county data shows from January 1st to March 31st of this year, officers referred people to the deflection center 62 times. 42 people engaged with the program, meaning they went to the center and talked with staff there. 6 people completed deflection. Completion is when someone accesses at least one service referral within 30 days. Those 6 people who completed the program accessed 8 services. 5 went to outpatient treatment, 2 got peer services, and 1 person went to detox.
Cool. We paid how many millions of dollars for one person to go to detox?
Multnomah County spent $3.8 million of taxpayer money to turn this building into the deflection center. Since it opened, a $4.3 million state grant has been funding it. That runs out next month. The county says they are anticipating more state money in October.
We should be getting people help, not spending money to do nothing.
David Watnick's children go to the neighboring preschool, which sued the county last year over closed-door decisions about the center.
You know, I think about it like as a parent of the school. I mean, our biggest fear was that it was going to create an unsafe environment. But if nobody's using it, I guess that means there's like less risk to the neighborhood. But as a kind of taxpayer and also somebody who cares that people with serious drug addiction are getting clean, it's like, what the hell is the point?
Yeah, I think deflection overall has been going really, really well.
Tony Vesna runs 4D Recovery. His outreach workers have been part of the program since day one.
What do you have to say to people who see these numbers and think it's just a total waste of taxpayer dollars?
Yeah, I mean, I would say to them, if deflection wasn't intervening on people, where else would they be going? Would there be anybody intervening on them?
Since the deflection program started in September 2024, officers have referred 283 people. 183 engaged with the program. 43 people completed it, with 16 going to outpatient treatment, 11 into shelter, and 7 to detox.
I'm actually encouraged about the number of people who are going into the program, but I'm not surprised to see the poor conversion rate for treatment because of the lack of capacity. One of the problems that we face is when somebody's intervened on and then they want to go into treatment, specifically withdrawal management detox, they have a hard time getting in the same day.
Oregon does not have enough treatment centers to meet the need, but there might be another reason people aren't getting to treatment.
I don't know anybody that's gone through it at all yet.
Al uses fentanyl.
I mean, personally, I've been out here since I was 14 years old.
And camps about a block away from the deflection center.
So basically you can only get help through that program if you get arrested for being caught, like using fentanyl or something?
Doesn't make any sense. Anybody that's using isn't trying to get caught. So obviously that's going to deter like people from getting into the program. Treatment should be something that you want to go to on your own. Nobody's ever going to get sober if they don't want to do it.
Yeah, I could understand somebody saying that. I felt that at one time, and I went to treatment voluntarily a couple times. And you know, the last time when I got clean, I got arrested and taken to jail, and I got an opportunity to think about what I want to do with my life. And the research shows that there is really no difference between compelled treatment and voluntary treatment success.
What the research does show is that the current county system is slow to meet the need.
Where's all the funding going if only one person's done it?
Yes.
I mean, we're still out here on the streets.
Why is it worth that much money and that much disruption, that much, dollars in planning?
Okay, so the next report on the deflection data covering April through June of this year is set to be released sometime this month. But let's remember, this county deflection program is not the only program working to get people on the streets connected to services. Many other groups, like those at 4D Recovery, are doing that work every day.
You know, you're not going to see the numbers show up in Deflection necessarily, but it has the Deflection framework where we have people in recovery. All they do is go out in the streets every day, work with PD, identify people who are using drugs who could use services, and we're getting 1 to 2, sometimes 3 or 4, sometimes families willing voluntarily to come in, get an assessment, and the biggest barrier is getting them into detox.
Tony's team is hoping to soon use the county's Deflection Center in Southeast Portland as a place to send people to wait until a detox bed opens up so they don't just go back to the streets and continue the cycle. Okay, talk to us. What do you think about the latest Deflection data? Did it surprise you? Why or why not? Email the story at kgw.com or call and leave us a voicemail 503-226-5090.